Now we'll welcome Dr. Stephen Robbins of Novant Health Urology Partners. Welcome to the show today, Dr. Robbins.
Thank you.
It's a pleasure to have you back today.
Thank you so much.
Some of our viewers out there may not have seen you the first time you were on the show, so let's talk a little bit about your background and just talk a little bit about yourself.
So I've been working for Novant Health for 2 years. Prior to that, I worked in private practice on Long Island in New York for 17 years. As far as training, I went to medical school at New York University in Manhattan and stayed in Manhattan for 6 more years for my urologic residency from Mount Sinai.
Wow.
Directly after residency, I started working and worked in the same location for 17 years.
Wow, that's a long time. That's almost a whole career right there. Now, I know everyone would enjoy learning more about Novant Health Urology Partners. So tell us a little bit more about the group that you're in.
So the group is myself and Dr. Lydia Labachetta.
And she's been on our show too.
Dr. Labachetta started working about 1 year prior to me. And at this point, those are the 2 physicians. We have 4 nurses in the office as well. And we provide full urologic care. For those who don't know what we care for, it is in men and women, the urinary system, which involves the kidneys and the bladder. And in men, it's the reproductive organs for men.
Okay. So do you offer those services in all of your offices?
The initial consultation and follow-up visits are in all of our offices.
Okay.
Any of the procedure-oriented issues are dealt with at our primary office in Bolivia.
So your primary office is in Bolivia at the hospital, near the
Yeah,
hospital.
it's on the campus of the hospital.
Yeah. So we talked a little bit about the services that you offer in your office, but how about hospital procedures? Let's talk a little more about that.
So the hospital procedures are typically surgically oriented, as urologists are surgeons. We offer diagnostic procedures for malignancies as well as non-malignant issues, but we treat mostly kidney cancer, kidney stones, minimally invasive procedures for kidney stones, minimally invasive procedures for malignancies with the robotic Da Vinci system. Also cystoscopic procedures for bladder malignancies and minimally invasive procedures for the prostate, including green light laser, photovaporization.
Oh yeah, we've seen that. That's been on the TV show before.
And the newest procedure that we're offering now is something called UroLift, which is a minimally invasive procedure, outpatient, for symptoms related to an enlarged prostate.
And those are all done in the hospital, is that correct?
In the hospital. And in the office, we offer cystoscopy, which is a diagnostic procedure, as well as ultrasound imaging for the prostate biopsies, vasectomies, and intravesical or in the bladder use of Botox for urinary frequency.
Yeah, I've read about that.
And it works quite well.
Great. And those procedures are offered in every office?
No,
or
at this time, they're being offered only in the main office in Bolivia. In the future, we may offer them in our satellite offices.
So, speaking of other offices, I know our primary focus today is to learn more about your newest location. So, tell us more about that location.
So, the newest place we're seeing patients in is in the South Brunswick Medical Plaza. We are there every Tuesday. Dr. Labachetta and I are alternating Tuesday, so one day I'm there and then the next she is there. And at this point we are offering only initial consultation and follow-up visits. We don't have any procedures to be performed there yet.
So if you saw a patient there for the initial visit, then you would schedule them for a later visit in Bolivia if a procedure was needed.
Correct. Either there or at the hospital.
At the hospital. That's a really nice facility. I know we were there for the open house and toured the whole facility down there at the South Brunswick Medical Plaza. But some of the viewers may not have heard about it. So let's talk about some of the other services that are offered down there at that medical plaza.
So the medical plaza will have, within the next couple of weeks, full medical care with family medicine and internal medicine. They'll have 3 providers and 2 nurse practitioners. We're also rotating through the other subspecialties of general surgery and OBGYN. And Novant Health has placed radiologic imaging there as well with ultrasound and diagnostic x-rays.
And that's great to have that service in that southern end of the county. Right now, everyone's driving up to the hospital for imaging services, so having that down there, and it's there every day except the weekends, I believe.
It is quite convenient for patients.
Yeah,
yes.
it's quite convenient. And are many of your patients, do they require imaging services? Is
Yes.
that something that you would typically?
Some of the imaging we provide ourselves in our Bolivia office, and some of them are sent to the imaging centers.
Mm-hmm.
Typically, it's either ultrasound or CAT scan imaging.
Mm-hmm. Okay. And you said that you would be there every other Tuesday, and then Dr. Lavachetta would be there.
Correct. So
on-
urologic services will be provided every Tuesday, and
Okay.
either myself or Dr. Lavachetta will be there.
And do you know the hours for those Tuesdays?
It should be 8 to 5.
8 to 5 every Tuesday. Well, that's great because it's a long way to the hospital, to Bolivia, to see the urologist. Am I correct that this is your third office?
Correct. I also see patients in Southport.
Uh-huh.
On the days that we're not in the new office in South Brunswick, we're at the office in Southport.
And that's on House Street, I believe.
Correct.
Yeah. That's at the office of Dr. Moore and Dr. Johnson.
Correct.
Yes. And the services that you provide there, are they similar to the services that you provide?
In the new office, so it's initial consultation and follow-up visits.
Mm-hmm. So, I know there's people out there who need to make an appointment with you, and how might they do that?
The easiest way is through the central office. The telephone number is 721-4150, and if they're interested in seeing patients either at the South Brunswick office or the Southport office, all they need to do is make a request, and it will be made through our main office.
Great. Well, it was a pleasure having you here today. Thank you for coming back.
Thank you for having me.
We look forward to hearing what's going on in the South Brunswick Plaza. So I hope you'll come back and talk
Definitely
to us
will.
and let us know how it's going.
Thank you so much.
Thank you.